Mrs. Sweeny. My name is Jeremy. I'm going to be your RN for today.
Okay.
Can I see your wristband real quick? Can you state your full name and date of birth for me?
Emily Sweeny, May 6, 1941.
Okay, and then who's with you today?
This is my daughter, Sydney.
Okay, is it okay if she stays in here while I ask you some questions?
Yeah, she's takes care of me.
She takes care of you?
Mm-hmm.
Okay.
We live together and I take care of her.
All right. So what brings you into the hospital today? Have you noticed anything that brings you into the hospital today as well?
Yeah, you can tell him and then I'll tell too.
Well, I just have had a lot of chest pain. I really like to go on walks and stuff, but that's been kind of hard for me.
Okay.
Just because I'm tired all the time. I wake up tired even if I get a good amount of sleep. I just feel like my body just feels super tired and like heavy almost. But I would say a big thing is definitely my chest pain, and it feels like my heart is almost fluttering.
Okay.
It's super uncomfortable, and it just, yeah, I feel like it's definitely impacting my daily life, and I'm kind of worried about it.
Yeah, I made her come in because she's been complaining so much about her chest hurting and feeling weird, and then she can't breathe, and sometimes she gets dizzy and has fallen down because of that. And so I'm very worried about her.
Yeah, that doesn't sound normal at all to me. So I'm going to take a set of vitals real quick.
Do you think she's gonna be okay?
Well, she appears fine now. I don't see any signs of distress, but there could be something underlying that we just can't see at the moment. So what I'm going to do is just grab a set of vitals, and then I'll go grab the nurse practitioner. They'll do a more in-depth assessment and diagnose whatever condition that they think might be contributing to those symptoms. And then we'll move forward from there, okay?
Okay.
All right. So,
What is this thing going to tell you?
this is a blood pressure cuff, and it'll give me your blood pressure, which is the force that your heart is beating blood into those blood vessels and how hard they're beating across that wall, okay?
Okay.
All right. All right, and then I'm gonna go ahead and take it. Okay, and it looks like your your blood pressure is 144/88. I'm going to go ahead and take that heart rate real quick. And it looks like your heart rate is 80, which is normal. The blood pressure is high, so...
Is that bad?
It is abnormal, but we really worry when this reaches 180. Right now it's 144, which is high, but she'll be okay as long as we move to treat that high blood pressure.
Is that why she's been feeling this way?
It could be, but I would refer to the nurse practitioner who will come in because they have a better understanding of this and will be able to make that diagnosis.
Okay.
All right, so I'm gonna walk out of the room. I'll go get our nurse practitioner, Juliana, and she'll be in to help you.
Okay.
Hello, Miss Sweeny. How are you today?
Okay.
Okay, I'm Juliana Field. I'm the nurse practitioner on staff today. I'm gonna be checking you out. Okay. Could you tell me a little bit more about your symptoms?
Well, it's affecting my day-to-day life. A lot of chest pain, my heart is fluttering, it just feels really tight, I'm really lightheaded, sometimes I faint, I'm just super tired, my body feels heavy and tired, and I just feel like sometimes I can't even get up. I'm so tired.
Yeah, and we used to go on walks, and now she can barely walk, and it's hard for her to breathe sometimes, and her chest hurts, and sometimes she falls. I'm very worried.
That is scary. I'm sorry to hear that. Well, we'll get you checked out. You're her daughter, correct?
Yes.
Gotcha. And then, sorry, what's your last name?
Sweeny,
And your date of birth?
May 6, 1941.
Perfect. You have the right patient. That's always good. Okay, so what I'm gonna do is I'm gonna listen to your heart first.
Okay.
Just listening for anything abnormal. Just have you sit still and breathe normal, okay? The next thing,
does it sound wrong?
I don't hear anything of note right now, a little bit of fluttering, but I can get a better picture of that on something we call an EKG. It's just a bunch of stickers on your chest, your arms and your legs. It'll take a picture of the electrical rhythm of your heart. Are you okay with that?
Does it hurt?
It does not hurt, it's just some stickers.
Oh, it's not gonna shock me or anything?
No ma'am, it will not shock you.
Okay.
Stickers and cords, it takes longer to set up than it does to read, okay?
Okay.
All right, so I'm gonna send someone in to get that picture for you, and then I'll be back in to talk about the results, okay?
Thanks.
Any questions before I go?
No.
Awesome. All right, so we got your EKG back. This is what it looks like. So what we see on here is something we call atrial fibrillation.
Is that bad? That sounds serious.
It's actually-
Is it a disease?
It is a dysrhythmia, which is a big fancy word for basically that your heart is beating incorrectly. It's one of the most common dysrhythmias that there is, and it's very treatable. So it's a good thing that you brought her in and that you came in today, and we'll get you on some medications to help manage that so you won't feel so fatigued.
More medications? There's medications for that?
Yes, ma'am, 2 of them. I'll go over them with you as soon as we discuss kind of what atrial fibrillation is so you can have a good understanding. Excuse me. So, how your heart normally beats, it goes like this, one after the other, and pushes blood throughout your entire body. With atrial fibrillation, or AFib, the top part of your heart kind of quivers. So it's not sending out as much blood, and then that blood pools up there. And when blood pools, and when it sits there, it forms kind of a little ball of blood, which is what we call a clot.
That doesn't sound good.
It's not a good thing, but that's why we're getting you checked out today so we can get you on medication to prevent this. So a clot can lead to something called a stroke. Do you know what a stroke is?
I know that you can die from it, doesn't it? I don't know, something with your blood.
That sounds serious.
Yep. So the medication she's getting put on today will help prevent this, but I just want you guys to know the signs and symptoms and what to watch for since you are at an increased risk, unfortunately. So that little clot will go from your heart up into your brain and block the blood vessels in there. And the brain's the boss of your body, so you'll see some symptoms throughout the body, like facial droops. So when you try to smile, it's kind of uneven, or you'll have some different changes in your vision.
Mm-hmm.
You'll feel a little unbalanced, or you'll have something called arm drift, where if you put both your arms up, one kind of doesn't quite reach there. So have you seen those symptoms?
Am I having that now?
No, ma'am, you're not having that right now. This is just something that could happen due to the atrial fibrillation
So
if
then
it goes
what do we
untreated.
do?
If that happens, you notice those symptoms or any changes in your mom, you're going to want to call 911 or take her to an ER so that she can get checked out. If it's caught, it's very treatable.
And then she won't be like that anymore? Like she could be able to smile then? Or her arms
Yes.
could go out normal again?
Yes, so if it's caught in an ample amount of time, then they'll give her a medication to break up that clot. But today, she's going to get on a medication that will help her reduce her risk.
Okay.
So I'll talk about the first one.
Getting the clots?
Yes, ma'am.
Oh, okay.
So I'll talk about the first one today, which is metoprolol. This is it treats your atrial fibrillation. It keeps that rhythm steady. Like I said before, how this is kind of quivering and not in line. It'll help it beat more fluently and as one. Does that kind of make sense?
I think,
Yeah.
yeah.
It'll also help lower your high blood pressure, so this won't be an issue, a factor for you anymore, as well as lower heart rate.
Is that bad though? Because low heart rate, then you die, don't you?
Not an abnormally low heart rate or a weird low heart rate. We will have it still be in a normal range. And Nurse Jeremy will go over kind of how to watch out for that heart rate to where it doesn't get into an abnormal range.
Okay.
The other medication that we're going to be prescribing you today, excuse me, is called apixaban. It's a blood thinner that you can take at home so you don't have to keep coming in to get labs done or blood draws. It keeps your blood thin so that it helps prevent those clots from forming so they don't go into your brain or into your lungs, which is something we call a pulmonary embolism. So that's another risk that you're at with atrial fibrillation. Excuse me. You will experience shortness of breath or chest pain or sometimes coughing up blood. So if you notice any of those signs or symptoms, again, you want to call 911 or get her to an ER.
Is that what happens when she can't breathe?
No, not necessarily. Since the atrial fibrillation, your heart isn't pumping enough blood to your body. It's kind of fatigued and feels a little more weak and tired, which is what you're experiencing right now. So hopefully that metoprolol and that apixaban in combination will help prevent all these issues from
Is that
happening.
why I faint? Because
Yes.
there's not enough blood going to my brain?
Yes, that can be an issue as well with atrial fibrillation because your blood is not pumping adequately. So just another couple key points that we're looking at on your chart here is you want to eat a low salt, low fat diet. So kind of those leafy greens, vegetables, those heart healthy foods.
Can I drink?
We're actually going to want to avoid excessive alcohol or caffeine use because that puts stress on your heart.
Yeah, we have that sometimes because we always go out for coffee. with
In
our
moderation
friends.
is okay, but just know that she is at risk for some things like heart palpitations or interfering with the metoprolol to where you'll start feeling those symptoms again. So it's just better to
Okay.
not drink as much caffeine or alcohol to keep
Why
your heart
can't I
healthy.
drink alcohol?
It puts stress on your heart.
Oh, really?
Yes, alcohol is not good for the body, so if we just take that out of the diet, it's much better for the heart. Does that kind of make sense? You also want to incorporate some exercise into your day-to-day life, like 10-minute walks. You'll start to feel a little less fatigued now, so that'll be easier because you guys said you like to go on walks, right?
Mm-hmm.
So if you could get those
We go
back
to
in.
water aerobics.
Yeah, if you feel up to it, definitely, that would be good. Just exercise as tolerated. Whatever your hobbies are, you can hopefully get back into them. You also want to manage your stress levels, excuse me, to keep that stress off of your heart again. And then just the big ticket items, if she were to faint, have chest pain, you experience shortness of breath, or your heart rate here goes under 50, you want to call 911 or get her to an ER. And Nurse Jeremy will go over kind of how to assess those vitals. Do you guys have any questions for me?
Well, she's already taking like 100 medications, so
Mhm.
is this okay for her to take with all of those?
Yeah, these were prescribed and looked at by a pharmacist to make sure that there's no contraindications, which is kind of like the meds interact with each other in a bad way, to make sure that everything meshes well, which there was no contraindications, so everything should be okay.
Okay.
All right, do you have any questions? Otherwise, Nurse Jeremy will come in here.
Yeah. No
Perfect.
questions.
Good luck with your AFib, and I hope you guys have a good rest of your day.
Thank you.
Come in.
All right. One more time. Can I see that wristband real quick? All right. Can you state your full name and date of birth?
Emily Sweeny, May 6th, 1944.
Okay. I'm assuming it's okay if your
Yeah.
daughter remains in here. All right. So here is your metoprolol and apixaban. So metoprolol, that's that medication that the healthcare provider told you about. It's going to act on that heart so
Yeah.
that there's less stress. What it does is it'll lower that blood pressure. Remember that vital from before, the 144/88. It'll lower that number, and that's going to produce less stress on your blood vessels, and hopefully it'll help your heart reach normalcy.
Could it be too low if she's on this medication?
It can. So metoprolol will lower that blood pressure. And so what we want to ensure is that the metoprolol isn't under, or when it's being administered, that her blood pressure is not under 190 for that top number. So we have 144.
Under 90?
Under 90. So if it's
How do I
under
know if
90,
it's under 90 or not?
So what we're going to do is we're going to take a blood pressure. Remember that cuff that I showed you earlier when I was
Yeah.
doing that and it showed up on the machine? So we have a few different ways of doing that. You can do that with the machine automatically, or you can do it yourself.
Okay.
And if you feel like you don't get an accurate reading, I can work with case management, and then they can have some kind of arrangement, or they can find a home health aide or something that can, or someone that can come in and measure those vitals before she takes this medication. But we do want to take a blood pressure before taking metoprolol because it does lower that blood pressure, and with a lowered blood pressure, what we see is maybe some dizziness, maybe some fatigue, maybe some unsteadiness, tired, you might feel tired. So that's why it's important that we get that blood
So
pressure.
she's already feeling like that, so this medication's gonna make her feel the same way?
It can make her feel the same way. That's why, as a nurse practitioner was saying, or has said in her discharge notes, is that activity and good nutrition will help offset that fatigue she's already feeling. And the more exercise you get, the more tolerance you build up, and she, in the long run, won't feel fatigue. Remember, this is a side effect, so she can feel this. It's not,
But maybe she won't.
maybe she won't, and if she
I hope
incorporates,
not.
I know, and if she incorporates these other interventions, then she will probably be okay in that.
Okay.
And then for apixaban, we have as a blood thinner, so it's going to prevent those clots from forming from that stasis and that atrium with that blood pooling in there. And so because it is what we call a blood thinner, she's at risk for bleeding. So we want to ensure that she is not doing anything intense to where she could injure herself and bleed. We don't want her to be in contact with or around sharp objects that could pose a risk. And we want to ensure that there are no pressures on her, like a hard surface, or if she does sit on hard surfaces like a chair, that she gets up and walks around to relieve that. We don't want to create an injury, and we want to prevent her from falling, because even though we might not see any bleeding inside, there could be some bleeding that we would want to watch out.
So what am I supposed to do if she falls and then she starts bleeding and then I don't know and then she's dead? I would be so sad.
Well, that's why if she does fall, that you take her to the ER or you call 911, and then they will do focused assessment and they will bring her in. They will hook her up to all kinds of machines and they will treat her for that fall and monitor for thin blood and bleeding. But because she's on a blood thinner, we don't want her to be taking any other blood thinners that will make her at an even higher increased risk for bleeding. And then we want
What are other blood thinners that I would take?
Warfarin, for example, is another blood thinner. Clopidogrel is another.
Are those on her? Do they know she's not taking those? Because she has so many medicines and I don't know what they do. I just give them to her.
It'll be in her medical chart, but she should wear a bracelet or some kind of identification on her, maybe in her wallet, that identifies that she is at a bleeding risk or is taking blood thinners, so that in the event of an emergency, like maybe she's not conscious or awake, they will be able to read that and quickly understand that she's on some type of medication that thins her blood. All right?
What other medications will I not be able to take?
Warfarin and clopidogrel. Those are both blood thinners. In a hospital, we generally want to stick to one, like maybe you'll be given heparin, maybe it's up to the discretion of the pharmacist or the healthcare provider to decide which medications. Sometimes they do have you on multiple blood thinners. It's just as you're taking them as they are, you don't want to. So with these tablets, we just want to keep them, we want to take them as prescribed, essentially.
So what about the metoprolol thingy that she's taking? You said that helps her high blood pressure, but how does that help that fib thingy?
So remember how the nurse practitioner came in and was talking about how those stresses on the heart, that atrium is kind of quivering and that can cause some of that pain. So that blood stays up there and that becomes an issue. So what it's doing is it's acting on those hormones, like you might know it as epinephrine, that creates those contractions. And so we're essentially helping the heart out by blocking that hormone. And so that heart will start to hopefully run a little bit better.
But it's going to slow her heart down, and slowing your heart down makes you die, right?
Well, if it drops below 60 beats per minute, which is that pulse that I showed you about, right?
So how does she check my pulse?
Okay, so let me show you. Go ahead and grab her arm.
Okay.
And what you're gonna do is you're gonna feel with your 2 fingers on this little divot right here beneath your thumb.
Okay.
And can you feel it? That little pulse?
Yeah.
Okay, so what you're gonna do is you're gonna count that for a full minute, and that full minute will be her pulse in numbers each time you hear that.
So what should it be?
Generally above 60.
What if it is 60?
If it is 60, that's okay to administer the medication. We worry about if it drops below 60.
So if she has a lower blood pressure than 90 and her heart rate is below 60, then I shouldn't give her the medicine.
Correct.
But also, do you swallow pills?
No, I don't like
No.
swallowing
So
pills.
how do I do that? Can I crush it? Because some of her other meds can't be crushed, and then she gets really mad when I tell her she has to swallow the pills.
Yeah, I hate swallowing pills.
Okay, so with this medication, we're giving it in a tablet form. Generally, tablet forms can be crushed. This one specifically, you can be crushed. But before you even think about crushing any kind of medication, you should check in with the pharmacist. They'll tell you for sure if it can be crushed or if it can't be. If it comes in like that pill form, it kind of looks like that oval shape, then you wouldn't. Those are extended release. So
Okay.
always check with the pharmacist. This one can be crushed, so if she wants to take it with applesauce or pudding or any other soft foods, she can. And it's very important that you adhere to taking this metoprolol. If you stop taking it abruptly, your hypertension and your
What is
atrial-
hypertension?
the high blood pressure.
That's what that means?
Yes.
Okay.
We call that hypertension because she's above 130. She is considered hypertensive. But
Okay.
all that matters is that it is a high blood pressure.
How many times a day do I take this?
You will only take it once a day.
Okay.
And then with the blood thinner, we have made sure that there is no lab work that needs to be done, so you don't have to come into the hospital to have any lab work done. And then just avoiding all those bleeding risks like the falling. Some medications might say NSAID on it, NSAID. They're usually, maybe you've heard of ibuprofen.
Yeah.
Those medications can also increase bleeding risk. We recommend that she doesn't take that. And if she
What
is
about
taking,
naproxen?
yes. Yes.
She can take naproxen or
No,
no?
she cannot.
Oh,
No.
okay.
No?
Okay.
Naproxen
So what's
is
she
a,
supposed to take if she's like hurting, like
Yeah,
in
I have a
pain?
headache. I
Like
have
she has
headaches
like
all the
headaches
time.
all the time.
so that is something you would ask your healthcare provider, and then they'll prescribe you.
What about what's it called? Acetaminophen.
Tylenol?
Yeah.
Is that acetaminophen?
Yeah.
Yeah.
That.
That medication is okay. It is not an NSAID.
So she
Oh,
can
okay.
take that with this metoprolol.
There's separate things we worry about with that medication, but with metoprolol, we don't find that there's anything of conflict that we would be worrying about.
All right.
Okay?
Okay.
When are we supposed to like since she has so much other medicines, they tell us some things that you have to do it when you should call the doctor. Like
So-
when should I call the doctor? It's like how am I supposed to know she's dying if she's taken too much of this medicine?
If you think, remember those side effects. If you think those side effects are inhibiting her daily life more than normally, that is something you would convey to the healthcare provider. Maybe they'll lower her dose. If you worry about drug interactions, like if one medicine interacts with another to cause some bad thing to happen, then you would also check in with the healthcare provider
Okay.
or a pharmacist. They can answer those questions for you. And if she's taking so many medications that you can't keep track of them, taking or having some way to organize them, like a pill organizer or a home health nurse who can come in and do those schedulings for her or administrations for her, that'll help relieve some of those.
Would that help you
Yeah,
to
I
have
think
a
so.
schedule?
Yeah, I think I like the pill organizer thing because then I always forget what time to take things at. So.
Okay.
Okay, let's do that.
Okay.
Okay, so can you guys, just for the sake of understanding and remembering, tell me what I just told you as it relates to metoprolol and apixaban?
It could make me more fatigued. That's a side effect of the medication.
Which medication?
Of the metoprolol.
Yep.
For the apixaban, I need to let people know that I'm at bleeding risk, and I need to be careful, like making sure that I'm not doing anything that could put me at risk for bleeding, like running into things, falling, just anything like
Using sharp stuff.
yeah,
Yeah. that.
and using anything sharp like with razors, just being careful, and then
And I have
for-
to make sure that her blood pressure is over 90
Yes.
and her heart rate is over 60, I think.
Yes.
And then I can give her the medicine, but if it's not that, then I have to not give her the medicine.
And if it is under, maybe we would recommend that you call the doctor or healthcare provider.
If it's under 50, right?
Yes.
Okay.
Okay.
Yeah.
Well, good. I'm glad you guys are able to fully understand the extent of taking these medications now.
okay. Thank you.
Yeah, of course. Do you have any other questions before I finish filling out the discharge paperwork?
No.
Okay, well, I'm going to leave then. That's your medication. I'll go ahead and grab the prescription order for how to take it, and we'll see if we can get you out of here, all right?
All right, thank you.
Yeah, of course.
Thank you.